Thank you very much, Minister Cox. Good morning to Minister Young, my colleague. Good morning to the Chief Medical Officer, Dr. Paras Ram. Ladies and gentlemen of the media, and to all persons in Trinidad and Tobago and wherever you are listening this morning. So this morning, Wednesday, there are some very interesting and disturbing developments as far as COVID is concerned. Before coming here this morning, I am just quoting a CNN report. Please don't quote me. I'm just repeating some disturbing news that CNN quoted this morning. And I'm trying to confirm it now about Hong Kong experiencing a third wave of the virus. And the term that CNN used this morning was mutation. Now that M word you never like to hear when you are dealing with a viral epidemic. You never want to hear the word mutation. I will be checking during the course of the day with the epidemiologist to find out really if this is in fact a true mutation, or as Dr. Carrington said here some time ago, whether the virus has just drifted, changed slightly or not. I tell you this because we are still in a global pandemic where to date 13,520,403 cases of COVID have been uncovered. The rates of infection keep going up. You are seeing certain states in the United States keep breaking their daily records for new infections. To date, close to 600,000 persons around the world have in fact died, the exact figure being 582,672. Ladies and gentlemen, the only way the world can get back to some state of normalcy is if we have a vaccine. And this morning, I want to share with you the latest developments, not as far as vaccine development is concerned, but as far as vaccine availability. Once a vaccine has been unearthed, how Trinidad and Tobago may be accessing vaccines. To do that, I want to quote from a letter of July 2nd, 2020, which is this month, addressed to the Honorable Prime Minister from PAHO. And the subject is access and affordability of potential, so note the word potential, COVID-19 vaccines, and updates on PAHO's collaboration with Gavi Alliance on Global COVAX Facility. Let me just explain what the Gavi Alliance is briefly. The Gavi Alliance is a global public-private sector alliance that deals with making vaccines available to underdeveloped and developing countries, especially vaccines to save children's lives. It was founded in the year 2000, and Bill and Melinda Gates are one of the major donors of this. I think they have donated about $1.5 billion towards this. The letter goes like this, and this is from Dr. Carissa Etienne to our Prime Minister, and I have the permission of PAHO to read this, and also the permission of the Prime Minister to read his reply. Vaccines against COVID-19 are urgently needed, and the Pan American Health Organization is actively engaged in global initiatives with the World Health Organization and other international partners to create access for safe, effective, and affordable vaccines. At our recently convened 166th session of the Executive Committee last month, Resolution CEI 66.R5 was adopted, directing our organization to support member states, which will include Trinidad and Tobago, in engaging with global initiatives such as access to COVID-19 Tools Accelerator for vaccines. As you are aware, leaders from the region of the Americas and around the world have consistently repeated calls for action through the WHO Assembly in May 2020, the Global Vaccine Summit in June 2020, and most recently, the Pledging Summit hosted by the European Commission on 27th June 2020 for the equitable, and that's an important word, equitable access to potential, another important word, COVID-19 vaccines for all countries, regardless of income classification. Why that last line is important is that sometimes countries, because of their GDP, national income, are shut out from accessing certain services. So what this letter is saying, regardless of income classification of countries, they will be allowed equitable access to vaccines. I will not read the rest of the letter, it is quite detailed and technical, but what I will now read is the response to this letter by the Honorable Prime Minister, who you know is the architect of our COVID-19 response. So the Honorable Prime Minister replied on July 13th, 2020 to Dr. Caressa Etienne, and parts of the letter goes like this. Dear Dr. Etienne, in response to your letter reference on access and affordability of potential COVID-19 vaccines, I want to confirm our interest in accessing potential COVID-19 vaccines using the PAHO revolving fund mechanism. I also note that our expression of interest is non-binding at this stage. I understand that as a consequence of this expression of interest, PAHO will engage in global mechanisms and market-shaping activities representing the participating countries. We are also happy to learn about PAHO's close involvement with the COVID vaccines global access COVAX facility being developed by Gavi and other global partners, and we welcome that PAHO member states participating in the PAHO revolving fund will be recognized as a unified bloc. So what this means is that Trinidad and Tobago in the Americas, we will be under PAHO's negotiating power as a regional bloc. Therefore, individual countries, small and large, don't have to beat their door to the vaccine manufacturers. It's a better way of acquiring vaccines for small countries especially. We expect that the COVAX facility will facilitate access to potential COVID-19 vaccines in an equitable allocation mechanism led by WHO at the lowest possible price regardless of income classification of countries. And that's very important because equity demands whether a country is rich, high income, middle income, low income. This is a matter that is humanitarian in flavor, and all countries need equitable access to the vaccines. So Trinidad and Tobago, and signed sincerely Dr. Keith Rowley, and this was signed off on July 13th, 2020. So ladies and gentlemen, what it means, if and when you have a safe, reliable vaccine, regardless of its price of production, Trinidad and Tobago, via the Honorable Prime Minister, who once again demonstrates his leadership in this issue, we are now firmly a part of the PAHO bargaining process to bring potential vaccines to Trinidad and Tobago. Whilst we wait for that, we have to continue to protect the gains that we have made at great sacrifice since we started our lockdown measures, our reopening measures, and our continued progress must continue. And we plead with the public that we are working in the best interest of 1.4 million persons to keep you as safe as possible. So Minister Cox, I want to thank you for the opportunity, and that's my update for this morning.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Hi, good morning, ministers, members of the media, members of the viewing and listening public. The clinical update for Wednesday, the 15th July 2020 is as follows. So the total number of tests done within the public sector, University of the West Indies and Caribbean Public Health Agency sites are 5,847. The number of unique patient tests done thus far, 4,388. Total number of repeated tests stand at 1,459. Total number of community tests in the public sector, 2,093. Total number of private sector tests, 1,245. The total number of positive cases remain at 133. Just reminding the public that the last 17 cases were all imported cases as we continue to bring in our persons from abroad. And we have gone now 85 days since our last local case. The total number of discharges are now at 124. Total number of deaths remain at 8. And the total number of hospitalized patients are now at 1. That individual is stable and well, awaiting the discharge criteria to be met before discharge. In terms of the quarantine status, we have 64 persons quarantined to date. The St. Augustine Day Bay campus, we have 25 individuals. At the Chancellor Hotel, we have 12 individuals. At the Napa, where our healthcare workers are, we have 8 persons. And at the Cascadia Hotel, we have 19 individuals. Thank you, Minister Cox.
Thank you very much, Dr. Parasram. The Minister of National Security, the Honorable Stuart Young, will provide an update on border management and the repatriation of nationals. Minister.
Thank you very much, Minister Cox, Minister Diyal Singh, CMO Parasram, members of the media, wider viewing and listening public of Trinidad and Tobago, and also, most importantly, our nationals who are outside of Trinidad and Tobago who tune in religiously to hear what the government's position is and how we're dealing with your repatriation. I'd like to start off by letting you all know every single one of our nationals outside who has applied to come back, applied to the Ministry of National Security for exemptions and approvals to come back. We are working day and night assiduously. Up to midnight last night, I was on the phone with the Permanent Secretary at the Ministry of National Security, seeing how we could squeeze in a few more persons, and I'll explain the whole process to you all now and what is going on currently. So I want all of you nationals outside there to know that we are working assiduously and with all our effort to get you, each and every one of you, back home, and understand that there are persons who have applied for weeks, some a couple months now, waiting and hoping for that indication that they are next on the group of people to come back to Trinidad and Tobago. As you've heard, we've already granted, and this increased the figure as of Saturday gone, 4,515 exemptions were granted, and we continue to work. The main reason people at Trinidad and Tobago continue so far to avoid what we just heard Dr. Parasram talk about, which is the local spread in Trinidad and Tobago at this stage, is due to the closure of the borders. All of our recent cases of positive COVID-19 have been re-importation and imported cases back into Trinidad and Tobago. But that is not stopping the government from doing all that it can to get all of our nationals back. As you are aware, we require every national who returns to be quarantined. That is part of the process. That is how we're managing our borders. And as we've said repeatedly, what happens is you need to balance it with our facilities, the public health sector's capacity and ability to quarantine persons, always with the risk that if there are positive cases and God forbid a spread in a group of persons coming back, that our parallel healthcare system that was so carefully built out is not overrun. We are doing everything possible to protect the 1.4 million people in Trinidad and Tobago from community spread. When you look at international news, and not so far from Trinidad and Tobago, a 3.5-hour flight to Florida. Florida is now the epicenter of spread in the United States. They now have the highest daily rate of positive COVID cases in the world right now. And this is what we're trying to avoid happening in Trinidad and Tobago by a very careful management of the numbers of persons returning at any given point in time. The availability of persons being able to be brought back in depends on our ability to supervise and monitor persons. We have 2 sets of quarantine set up: state quarantine for those that the state will fully pay for their quarantine period and whilst they're in quarantine, and we've expanded our state supervised quarantine facilities. The state quarantine facilities, as you're aware, but it's worth repeating, are the Day Bay UE campus, Tacarigua, Sandy Grande, home of football, and Balandra. We have expanded our state supervised quarantine for persons who are willing to pay for quarantine. But again, the numbers are limited because remember, we need to have our nurses and our doctors present to make sure people are being properly quarantined. If anybody presents any symptoms, any presents any illnesses. Also in some of these facilities and the numbers that you just heard Dr. Parasram refer to, we have persons who've returned from cancer treatment, cancer survivors, low immunity rates in some of these state-supervised quarantine at Cascadia and Chancellor, and we're managing that. We've added now the Regent Star, which is up at Piarco, to give us more capacity, to offer more people the opportunity to get on those flights to come back home. Just to let you all know what is currently going on. As you all are aware, we've brought back people from Mexico, Venezuela, Guyana, Suriname, Barbados, other Caribbean islands, and persons on cruise ships, the UE students in Barbados, Jamaica, also rig workers, oil and gas workers in the thousands, and we continue to manage it. And so far, fortunately, and I want to give a lot of thanks to all of the Ministry of Health personnel who have effectively managed the quarantine and return of these thousands of persons still without there being community spread of COVID-19 in Trinidad and Tobago. And we should never underestimate or lose sight of that. So I thank all of them, applaud them for the months of hard work, as well as the Ministry of National Security personnel who secure these facilities. Today, 15th of July, at 4:20 p.m., so this afternoon at 4:20 p.m., we have 76 nationals returning from Grenada. 76 nationals. Out of those 76 nationals, only 4 are going to state-supervised quarantine facilities. So immediately you see that 72 nationals returning today go immediately into the state quarantine facilities at Debe and Tacarigua. So immediately those 2 facilities are up to capacity. Out of that, there are 25 students, 10 faculty members, so 35 who are studying or associated with studying in Grenada. On Friday, the 17th of July, we have worked with Caribbean Airlines to do a repatriation flight from Canada. Of course, we can't bring everyone back on the first flight. So what we had to do is go through the list, persons who applied a long time ago. Understand there were some people who went abroad for a 1-week vacation and then got caught outside there. There are others who are now finding themselves in more trying circumstances. How do you balance that list? How do you balance the person who went out for 2 weeks, ended up having a baby out there, has postpartum issues now and is suffering from depression, with someone who now runs to the media to claim, I need to come home immediately? That is not a fair process. So whilst I understand the anxiety, we as the government understand the anxiety, the frustration of persons who run to the media and highlight their personal issue to the detriment of others who have been waiting patiently, who have abided by the rules, who have waited, who are messaging us, who are emailing us, and we're in correspondence with them. Those are the difficulties. And that's not something we can encourage, because it certainly is not fair for a person who took a decision to go to visit family last year, to spend months when they saw what was going on with COVID. They decided to stay with their family. The border is closed, and now they're rushing to the media to put the pressure, as opposed to somebody who may have gone for work-related issues or gone to shop for, and these are real cases, gone to shop for baby clothes, got stuck there, had their baby outside of Trinidad and Tobago, have run out of funds, and are now. So is it that they are doing what they can? They're agreeing with the government's position that they will get back here as soon as they can, and because they haven't run to the media, these are the difficulties. Do they get now pushed down the queue, the line, even though they put in their exemption on the 24th of March, compared to someone who put in their exemption sometime in June and is utilizing certain outlets to try and pressure everybody else in the queue? Because it's not pressuring the government. We are adamant that we're bringing everybody home. On Friday, we will be bringing back 71 individuals from Canada. So you add that to the 76, that is immediately up to 147. Out of the 71 people coming back on Friday from Canada, only 19 are utilizing the state-supervised quarantine. So now we're offering, when we give people the approval, we're saying, please indicate to us whether you would be willing to pay for state-supervised quarantine at a hotel. Some families have taken up that offer, so it allows us now to bring back other people into the state quarantine facilities. But out of 71 approvals and exemptions granted for Friday, for the first flight, and there will be further flights from Canada, Caribbean Airlines flight working with us, only 19 individuals, and most of those are family members. So a father, a mother, and 3 children are going into the state-supervised quarantine. So that means we need room for 52 individuals. They are going to the home of football. So again, another quarantine facility is up to full capacity, because now you can't mix persons. You have the groups coming back from Canada. We can't mix persons from the United States with them because they're different risk profiles, and you don't want to increase the risk of persons contracting COVID whilst in quarantine. We have also granted, to date, approximately 80 approvals for persons in the United Kingdom, mainland Europe, and the Middle East, who we expect to be coming home in the next week and a half. So you have 76 today from Grenada, on Friday 71 from Canada, and then 80 approvals granted from the United Kingdom, Europe, and the Middle East. So doing those math, you immediately see that our state quarantine facilities are up to capacity at the current time. And we're hoping now, in between there, what you all need to be aware of, there are some instances where you may have an air ambulance coming in, you may have other persons coming in. So in our miscellaneous category, we have some workers. You all will recall some workers who were working down in Suriname decided not to come home when we were expatriating people back from Suriname, and now they are also being let in. Some workers from Suriname and Guyana, a total of 12. Then you have some other persons with medical issues and other issues who've been right there on our doorstep. And when we start to add those up, that's another 9. Then we have the students from India and 2 cruise ship workers who are out in Europe, in the United Kingdom, and that's 7 there in total. And then we have persons who are coming in for emergency repair work on some of our energy platforms, some of our manufacturing platforms, because our local manufacturers are asking for foreign workers to come in to upkeep their equipment. We don't want manufacturing. We've kept our energy sector going to drop at all, so they too, in little sparse amounts, are coming in as well. So that totals right there over 35 persons as well. So when we add all of these numbers, we are now up to full capacity. It is not stopping us. We are now looking, and I'm working closely with Ministry of National Security, is working closely with Caribbean Airlines, because we are aware that we have a lot of nationals who now need to leave Trinidad and Tobago and go back up to the United States, or students, for example. So we are looking at working with CAL to get some flights from Trinidad and Tobago back up to the United States that would assist students who then have to go on to school. Fortunately, we saw the US government back down from a position they'd taken earlier that had created a whole set of anxiety in our parents, understandably, where the US government said if your classes are online, you have to leave immediately. That situation now, thankfully, the United States government has retracted from that, so those students are not at risk. Though we are now going to be planning with Caribbean Airlines some flights to take persons out and, of course, to repatriate people. But as I've just tried very carefully to explain, right now our state quarantine facilities are at maximum capacity, and those are 14-day cycles. Of course, the risk is, if there is, God forbid, an outbreak or some positive spread in that, you then have to, when you decant the facilities and everybody finally gets home safely and are tested negative, according to our public health experts, we then have to air out the facilities. But what we're doing is we're looking at, I'm going to be working with the Ministry of Health, National Security, to see if we can identify some other hotels that are outside of the way, that are not around populations and residents, that we can increase our state supervised quarantine facilities to now offer more of that, especially as we want to start bringing back persons from the United States. So the message is, we are working hard to get everyone back. We will get everyone back. Right now, there are no commercial flights being allowed into Trinidad and Tobago for the exact reasons we've stated. But we are getting to the United States as the next category. Understand these numbers from Canada, United Kingdom, Europe. That's not everybody who's there. So these are the first repatriation flights. But what we're doing is we're trying to make sure we're as fair as possible. We have students who are writing us from Colombia who are trapped there. We're trying our best. But the United States is our next area of focus. The students who are in Trinidad that need to get out, we are aware of it. We know the timing of schools, and we're working with CAL to put on the flights to get you all back up to the United States and Canada where you need to be, and to turn those flights around into repatriation flights. But in deciding who it is that will be on those repatriation flights, it is coming down to, as one category, those who applied earlier clock. Not those who are applying now, later on, because we do have instances of persons who were making their lives and living in Canada and the United States, and now for whatever reason they want to come back to Trinidad and Tobago. It's not fair for those persons to jump a queue of persons who just went out for a visit and are stuck outside there. What I'd also like to say is, in discussions with the Prime Minister this morning, a decision has been taken, and he's going to be asking the Minister of Finance to send certain sums of money to our consulates or missions or embassies in the United Kingdom, Canada, and the United States to try and assist how we can. Now, it's going to be limited sums of money sent to the most needy cases and the most legitimate of cases. I will be working with those various consulates, embassies, and missions using the lists of requests for exemptions that we have at National Security to try and identify those who may need when they come to those embassies, missions, and consulates asking for help. It is a very difficult exercise, and we expect that there may be some who would try to abuse the system, but we're going to do the best we can. So we are, as a government, taking a decision to send some funds to those various consulates, embassies, and missions to try and assist some of our more needy nationals who are outside there. Not the ones who are living and carrying on their lives outside in these countries, but those who went on short visits and have now found themselves in difficult circumstances that we are very aware of. It is a difficult system, but it is a fair system that we're operating. CAL is not running scheduled flights. We will continue to work with Caribbean Airlines to see how we can do some pickup flights, as we call it, some repatriation flights, and we will make those announcements as and when they happen. When we send out the approvals, we're asking people to please indicate whether you're prepared to pay. Now, there were a lot of people who said, yes, they will pay. And then when we wrote to them, of course, they're saying they need to go into state quarantine facilities. So that's why I gave you the numbers. So 71 persons in Canada granted exemption. Only 19, quite a few of which are families, are using the state supervised, i.e. the paid for quarantine system. So even when people are saying they're prepared to pay for quarantine, and we don't expect them to, it's an option. Even when they say they're prepared to do that, when you start to crunch the numbers, unfortunately it hasn't worked out, but we are looking at expanding our facilities and the ability with Ministry of Health to quarantine more persons so we can bring in more flights. I just want to stick a pin that right now the United States is the largest number of applications we have, running in the thousands. Unfortunately as well, United States is now the epicenter globally of positive COVID cases, and the areas where we're looking at a lot of our nationals in Florida, for example, that is now the epicenter globally, producing the most cases. Also in Texas, family in Texas. The Prime Minister has told us about family in New York, his daughter in New York. It is not an easy situation, and don't think that we are not aware of how difficult it is. But we are the ones who are tasked with the responsibility of applying a fair process to all of our nationals who are looking to come home and getting them home, and we will get it done. Be assured that we will get it done. Unfortunately, due to the cycle of this virus, COVID-19, there's a 14-day period that we're running through. There are record-breaking health issues in the United States. We will continue on working on bringing you all back. But the quarantine has been used, and it has been proven to be very effective in protecting the people in Trinidad and Tobago. The United States is now suffering, and that is where the risk is greatest. So we need to be cautious and not squander all of the good work that you, the population, have done by listening to our health experts and the scientific evidence and the scientific advice that has gotten us this far. Please be assured that we are not sleeping, and we're working as hard as we can to ensure we get all of our nationals back in the shortest possible time frame, but balancing our quarantine facilities and ensuring that we don't jeopardize or risk the population that is in Trinidad and Tobago. Minister Cox, thank you very much.
Thank you very much, Minister. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to post questions to us, but that means in our limited time, we'll have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. Wired 868.
Hi, good morning. Lasana Live at Wired 868.
Morning, Lasana.
Good morning. On Saturday, I asked about youth sport and whether or not it could proceed. The CMO at the time said that, let all activities related to children be held back until September, which is a quote. But immediately after that, the Commissioner of Police said that there actually was permission granted from the Ministers of Health and National Security and so on to play the Youth Pro League. And the inconsistency in those 2 statements has caused some confusion in sport over the last couple of days. So I'm hoping that the CMO or the Minister of Health could clear it up this morning.
CMO?
So my statement that I've said all along is that children should have been held until September. I don't know in terms of the regulations, as far as I know, don't speak to the age of persons being able to conduct any sort of activity. So from my side, Minister Cox, that's where I stand.
Minister Cox, maybe I could assist here because we don't want this to continue to be a rolling snowball going forward. You've heard what the Chief Medical Officer has said. I have had numerous conversations with the Commissioner of Police, including on Saturday, as has the Minister of Health. The CMO's advice is exactly as he stated, but the regulations don't prevent it. So at the end of the day, there is no law that is being broken, but the medical advice is for them just to be cautious. So I don't think this is a conversation that can continue to mushroom.
Let me just come in here to not to lend clarity to the law, but to bring a sense of sobriety to the discussion about children. It is difficult to legislate for everything during a pandemic. When this pandemic first started, it was seen, and if you go back to the earlier press conferences, the science at the time told us, and experts were here, Minister Cox, and you may remember, the experts at the time said that this was a condition, a virus that mainly affected the elderly, and that children would brush this off and that young adults will brush this off. With time, and as millions and millions more people got infected, people of different races, in different socio-economic conditions, you started to see a change in epidemiology of infection, where children were now being more adversely affected than before. We are appealing to parents and organizers of children's activities, even though the regulations may not prohibit activity. If you want your child to be alive, if you want schools to open in September, I will now read for you an example of the change in epidemiology of the virus as it concerns children. It is highlighted, healthy teenager who took precautions died suddenly of COVID-19. This young boy says, it began a 12-day journey that would end in tragedy. I can't tell you how a perfectly healthy 16-year-old boy can be making his own peanut butter sandwich late Wednesday night, getting his own tea out of the fridge, and head up to bed like any other teenager in a state or in a country is doing. And then within 24 hours is fighting for his life. Ladies and gentlemen, we cannot legislate for everything. There comes a time now where parents have to make a decision. These are your children. With the evidence of the change in epidemiology and how children, young, under 5, they are now dying. They're coming down with something similar to Kawasaki syndrome. They're getting COVID toes, COVID fingers. Are you prepared to take that risk with your child? Forget the regulations. I am asking parents a direct question. Are you now prepared, in the face of the mounting evidence, that this virus has changed the way it attacks children, young adults, from 2 months ago to now? Is that a risk you're prepared to take? And I think every parent, Minister Cox, will have to answer that question and make that decision.
Yes, so true. I think Wyatt 868, you have another question?
Yes. Okay, yes, a follow-up question to the Minister of National Security. You gave us a lot of information there in terms of citizens returning to Trinidad. A lot of the concern, though, from people abroad has been what they believe is a lack of acknowledgement to the request to return, or just uncertainty regarding where they stand in the queue and why, and access to support. Could you explain what the government is doing in terms of those issues, and maybe how the government might improve interaction with citizens outside who sometimes want the information as much as they want to return?
Thank you very much. Those are very legitimate concerns, because I can understand someone who's outside and they just think they're waiting there and waiting their turn, the level of anxiety that builds up and the complete lack of certainty. So what we're doing is we're going to try to improve the responses, but understand you have understandably a lot of anxiety. So yesterday when I met with the team just after lunchtime, we had over 635 email for yesterday alone. Some of that may be repeat email because persons are not, and that's why what I'm indicating, really trying to indicate here today, is how we've been dealing with it is on a country by country basis, looking at the numbers. So right now we have Grenada, Canada, the UK, Europe and Middle East. Those are the big categories coming in. We're seeing where we can fit some smallers in between, and we're dealing with the United States next as soon as we have some level of certainty. But understand, when you have a list of, let's say, 2,000 persons applying from the United States and you're only able to put on a couple flights, that's a maximum of a couple hundred persons coming in. So what we look at is we look at the date of when the applications we put in. We have been looking at the circumstances. We've been looking at the elderly, the sick, persons who have small babies and children. And that is how we're going through it in a very fair process that can stand up to the levels of scrutiny. And we do understand how difficult it is for every single national outside there who is waiting on their turn to return. And we will try to improve. And one of the ways is by just continuing to provide as much information as we can.
Minister Cox, let me just explain now the health component of what Minister Young is doing at national security, and why the conversation about repatriation is not only about numbers of quarantine spaces. The health side of the coin, the flip side of the coin is this, and I'll give you 2 examples. When we brought in the first batch of cruise ship persons, the Costa Favolosa from Guadeloupe, I think there were 68 persons, and I think about 52 of them converted to positive. That was a conversion rate of 71%. Could you imagine if we have a conversion rate of 1,000 persons coming back of 71%? That is 700 persons we have to find spaces for. The health system will collapse. By other example, we brought in the 306 persons on the other cruise ship, the cruise ship workers, but 9 of them turned positive. That's a conversion rate of 3%. So we were lucky. But when you look at these 2 extremes, on the one hand, I had 78% converting to positive, which I had to find space for in the hospital system. So it's not only about bringing in back people. We have to have in the back of our minds, what is the potential for conversion from negative to positive, and then we must have the hospital capacity to treat with it. So, for example, if we use the 71% from the Costa Fabulosa, if 71% of the 306 persons on the recent cruise ship turned positive, that's over 200 persons that we have to find space for in the parallel healthcare system. That will eat up in one fell swoop the 100 spaces at Cora and 100 and something at Couva. And if perchance that there was a community spread from somewhere, where would the country be? So what Minister Young and I are doing on a daily basis is not only balancing how we bring in people, but in the backs of our minds, we have to wonder what is the potential conversion rate. And I've given you two local concrete examples. Costa Fabulosa, 71% turn positive. And Enchantment of the Seas, 3%. Which one, which one can we depend on? We always have to assume and prepare for the worst and hope for the best. So it's a little more than just quarantine spaces. On the health side, the potential for conversion to positive, and how do we treat with that? Thank you very much.
Thank you very much. 98.1.
And a very good Wednesday morning to the panel ministers, CMO Stephen Cummings, 98.1 FM. Minister Dayal Singh had first posed this question to you. You mentioned a mutation of the virus in your opening, but I'm seeing also where a leading U.S. medical journal known as the Proceedings of the National Academy of Sciences in a study found that silent transmission could be responsible for half of COVID-19 cases. The model assumed that COVID-19 may be most contagious during the pre-symptomatic state, which it says it's uncommon for respiratory conditions. I'm wondering if, when we are talking about mutation, if in fact there's some kind of relationship between the mutation process and silent carriers. And another question I have here for the CMO. CMO, a recent report of persons or person who may have impersonated the office of the CMO, leading to potentially damaging information going to the CPL officials. Can you say exactly when this purported breach would have occurred or discovered, and whether an official investigation has been launched to ascertain the source of such an act? Thank you.
Okay, so Stephen, I will take the first question. What I said, and I was clear in my opening statement, I was saying this is a report coming out of CNN this morning. And I did say I have my experts now looking at it. So Professor Christine Carrington, all things being equal, should be here on Saturday. I have primed her since last week to be on to talk about these latest developments, because the epidemiology is changing. What we knew about the virus as it attacked young persons 2 months ago is now out the window. What we knew about the virus 2 months ago, how it attacked children, is now out the window. So Professor Carrington, all things being equal, will be here on Saturday to talk about how the virus is changing, whether it is changing slightly or significantly. Okay? Thank you very much.
CMO?
Okay, so in terms of the claim with regards to CPL, that matter is still being investigated. I know my permanent secretary has contacted the Ministry of Sport to find out what sort of communication took place. And once we get that information from them, we can determine, what was the source of the leak, for if there was a leak in the first place. But just to be assured that I had communicated directly to the CPL organizers again, post the incident, just to assure them that nothing has changed. The note that went to Cabinet, of course, if we have to have any change going forward in any procedure at all, seeing that Cabinet has endorsed the quarantine procedure laid out in that document, that of course we have to go back to Cabinet before any change can occur. So they are well, as far as I am aware, they are happy with the position that we stand at present. There's a meeting of the local organizing committee, of which I'm a part, tomorrow at 10, to further concretize the quarantine arrangements and to ensure that, whatever we put in place before is being adhered to.
Minister Cox, let me just go back to the child issue, because I know parents want to play football, karate, and even though we talk about the change in epidemiology, I want to quote just to alert parents that what we are doing at the Ministry of Health, we are not trying to punish anybody by not playing football or karate or gymnastics. UNICEF, UN News, COVID-19 pandemic is quickly becoming a child's rights crisis. The daily death rate could be 6,000 for under 5s. Ladies and gentlemen of Trinidad and Tobago, COVID-19, because Trinidad and Tobago has done well, success now is breeding expectations. And the more successful we have become in protecting Trinidad and Tobago, the more the expectations are. I am bringing the latest science from world-renowned bodies. This is UNICEF stating, let me repeat it, COVID-19 pandemic is quickly becoming a child's rights crisis. We want to protect our children. And as I said, the major prize that is within our grasp right now is the opening of schools. And that is why the CMO, and I support him in this. I don't want the CMO to take the blows on this alone. Share it with me, because I support him in this when he is advising parents to keep your children under wraps until schools open. So I'm hoping this plea really strikes a chord with parents and all those who want activities for children to be opened up. Thank you very much.
Thank you. Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited.
Morning,
Hope you all are doing well. I just have two questions, one for the CMO or Minister of Health and one for the Minister of National Security. So to the health officials, I remember a few months ago at a press conference, it was made mention of that the ministry is conducting surveys of all the persons who would have tested positive for COVID-19 and would have recovered, and that a report was being done. And I believe it was sometime in July, you all said the report may be made public. So I just wanted to follow up on that, see if that is still being done and where it's at. And for the Minister of National Security, I just want to get a little bit more information about these funds that are going to be sent to the consulates and missions in the United States and whatnot. I know you said that you all are still going to, or you still have to speak to the Minister of Finance, but I just wanted to know, do you all have a budget in mind and any, just if you could give me some more information on how you all anticipate this is going to be executed.
We'll go with the first question first.
Thank you. So, Richard, thank you for the question. The surveys and the retrospective study is ongoing. However, it has had to be slowed down because of the sheer volumes of repatriated persons we are bringing into the system. They have to be cared for. So, for instance, the CMO has to be involved in that. I have to be involved in that. Dr. Mariam Richards has to be involved in that. Dr. Avery Hines has to be involved with that. And these are the same persons who have to write those reports. So we don't want to take away from the medical aspect of managing the repatriated persons for the sake of writing a report. So the reports are being done, but at a slower pace, because right now we have changed from managing COVID positive patients, the initial 115 and so on, to now managing these hundreds and thousands of persons that are being repatriated. So both are going on simultaneously, but the focus is on the repatriated persons. Thank you very much.
Thank you. Minister?
Just to very briefly answer the second question, as I said, this is a very, very current situation. It's a very new situation, but the message is that what we're going to try to do, working along with the Ministry of Finance, Ministry of Foreign and CARICOM Affairs, and the various missions that we have in the United States, Canada, and England, the United Kingdom, is get some sums of money to them there was a figure quoted, but I don't want to say that figure as yet, and work out a process where they will work with the Ministry of National Security when persons make requests for us to identify how we may be able to help. So it's in the infancy stages. If and as it goes along, more information will obviously have to be put out so persons will know who qualifies and how they apply, etc.
Okay, thank you. AZP?
Hi, good morning. Priya Bihari, azpnews.com. Minister Young, just to follow up on an individual case, there are some people, 3 people, I think, in the BVI in Portola. They have made their own arrangements to come home, but they're waiting on an exemption, and they said that they have made the application a long time ago. So they just wanted to find out, the family has contacted me and they wanted to find out exactly what is their situation in terms of where on the line they are. And the second question to the Minister of Health, on the hustings, there are a lot of candidates who are shaking the hands of voters, of potential voters. Sometimes, that is part of our culture, but is that something, we have to discuss in terms of the Ministry of Health, because the new normal, doesn't adhere to such things. I mean, and in this election here, that's part of our culture. Can you just give us some information on that? Yeah, thank you.
Sure. So thank you, Priya. So I would have addressed this issue about campaigning and health on Monday, and we are asking candidates and political parties. People are looking to us for leadership on this issue, and I think, as difficult as it is, I have avoided shaking hands as far as humanly possible. I don't shake hands. Manage your crowds in numbers of groups of 20 or 25. If you have enthusiastic supporters of any political parties, you have enthusiastic supporters, make sure you have hand sanitizers for them. Separate them into groups, make sure they wear masks. I know I do it when I go out. I have bought masks and we distribute them. So I think all candidates need to behave responsibly and advise their supporters. Get your campaign managers involved, get your area managers involved, and your activists involved.
Thank you, Mr. National
With
Security.
respect, thank you very much, Minister Cox. With respect to the first question, I will have the Ministry of National Security team look into it.
Okay, thank you. TV6.
Good morning, everyone. Elizabeth Williams.
Good morning,
TV6
Elizabeth.
News. Good morning.
Good morning.
This question is to the Health Minister. I don't know if you would have addressed it already, but student nurses who are doing rotations on the wards, how soon will they, in terms of continuing their rotations as they have final exams to be done? And the other question is to the Minister of National Security. I don't know, Minister Young, if you are aware of students in the UK who would have applied for exemptions, and if they are being considered, because what we are hearing from these students is that they have applied since May and they have not gotten any response. Thank you.
Okay, Elizabeth. So the Minister of Health has no say into the rotation of nurses. I think very often we lose sight of the fact that nurses and doctors are employed by an RHA. The RHAs are the ones responsible for rotation of nurses. Each RHA has a general manager of nursing. Each RHA has a general manager HR. And at the ministry, we have Nurse Betty Ann Pilgrim, who is the National Director of Nursing. So if there are any questions as to rotation of nurses and exams, that can be easily dealt with by the general managers of nursing of each RHA, the HR managers at each RHA, or at the Ministry of Health, Nurse Betty Ann Pilgrim, and I will suggest that the queries be sent in those directions.
Okay,
Answer the question. Thank you, Minister Cox. Answer the question with respect to the students in the United Kingdom. The answer is yes, we are aware of them. As I was very careful to point out, we are repatriating 80 persons in the first batch. And what you're doing is you're really looking at a prioritization. So the students would have become sending in their applications during the month of May. But we had other persons, for example, there was a group of 8 senior citizens who saved up their money. They went out there to the United Kingdom in March and February, and then they got stuck out there. So it is really a prioritization. The students will be looked at in the next batch of repatriation to be done. But one of the messages here this morning is in our management of the numbers, as we try to get everyone back home, there needs to be some prioritization, and that process is being done. And it is not about who can go and draw the spotlight on their particular circumstances. That's just simply not a fair process when you have, for example, these 8 elderly persons who have been out there for an extended period of time with no family, no accommodation, and these types of things. But we are very aware of the UK students all over the world, some whom have lost their accommodation due to the end of the rentals, etc. And we're working as quickly as we can, and we will be looking to expand the process to accommodate more as we go forward. I just want to correct one error that has come up that the staff at the Ministry of National Security have sent to me. With respect to the Grenada flight today, it is 76 persons coming in. One of the newspapers has run a story of 75 students. I didn't say it was 75 students coming in. 76 persons coming from Grenada, 25 of which are students. Thank you.
Thank you very much. I want to apologize for many of you. There are many hands still up, but we've come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we go, we would like to appeal to our citizens, both here and abroad, to be patient with us as we manage the return of our nationals who are outside of Trinidad and Tobago at this time. We know many of you are desirous of returning home and long for familiar surroundings. We also understand that some of you are facing challenging circumstances which must be difficult and trying, but do understand that the government has to be responsible. COVID-19 remains a real threat, and as we continue to live with this pandemic, the government continues to place emphasis on preserving lives. And this means that every decision to grant an exemption to citizens abroad takes into consideration the number of persons required to quarantine and who may be hospitalized should they test positive for the virus. It is not as simple as granting an exemption to those who can afford to pay for a room to quarantine on their return. The government also has to take into consideration and to prioritize our citizens who have health complications, the elderly, and those with children. Our emotions cannot dictate our decision making. Our population has depended on us and has so far been protected because we are guided by advice from our public health officials. Remember, it is our duty to protect those within Trinidad and Tobago from COVID-19. This is even more important as the World Health Organization reported that as of today, there are over 3 million confirmed cases of COVID-19 with over 135,000 deaths in the United States. The latest statistics from the Pan-American Health Organization showed that the regions of the Americas accounted for 6.8 million cases and close to 300,000 deaths. Put simply, this equates to roughly half of all cases and deaths reported around the world. PAHO noted that the number of people dying of COVID-19 is also climbing, particularly in Brazil, Mexico, and the United States. The fact is that the majority of citizens applying for exemptions to return to Trinidad and Tobago are from the United States. We do understand what it means to be stuck in a foreign place, which is why to date, the government has granted over 4,500 exemptions to citizens to return to this country. Another 3,000 applications for exemptions are pending, and please be patient. Everyone cannot be facilitated at the same time. And the return of citizens must be managed on a phased basis in accordance with the capacity of all facilities that form part of the parallel health care system. Do remember, we can all survive this together. All of us are making sacrifices during this pandemic, but if we manage this well, we all can come out of it healthy and alive. I understand it is tough, And we feel your pain, but we are also pleading for your patience and understanding. I know it is not easy, and we are trying to get you here as fast and as safe as humanly possible. Hold on. Hold strain. The government is working on your behalf. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. Save lives. May God bless Trinidad and Tobago.